Endometriosis needs to be taken more seriously. Around 176 million people in the world have endometriosis. An inquiry spoke to more than 10,000 people who suffer from endometriosis about their experiences when getting diagnosed with this condition. It argued that the UK government needs to take the condition more seriously. In the UK, endometriosis affects 1 in 10 women. The inquiry found that on average, it takes 8 years to get a diagnosis. Sadly, this has not improved in more than a decade. 58% of individuals told the inquiry that they had to consult their doctor more than 10 times before being diagnosed with endometriosis. 53% said they had to go to the emergency room due to their symptoms. The participants also emphasized how their symptoms affected their education, work, and mental health. 35% reported having a reduced income due to endometriosis. 90% said they would like to have access to psychological help during diagnosis but were not offered such service. Endometriosis is often a painful disorder that usually involves the ovaries, fallopian tubes, and the tissue lining in the pelvis. It is a condition where tissue similar to the lining of the uterus grows outside the uterus. In rare cases, endometrial tissues may spread beyond the pelvic organs. Endometriosis can sometimes cause severe pain, heavy menstrual bleeding, and fertility issues. Not only is it painful, but it also jeopardizes your mental health and standard of living. Studies by the World Endometriosis Research Foundation found that late diagnosis of endometriosis could stem from shared symptoms with other conditions and misinformation about endometriosis. It is sometimes mistaken for other conditions that can cause pelvic pain like ovarian cyst and pelvic inflammatory disease or PID. Moreover, endometriosis may be confused with irritable bowel syndrome or IBS. It is a condition that causes bouts of abdominal cramping, constipation, and diarrhea. IBS can accompany endometriosis, further complicating the diagnosis. Endometriosis.org emphasized the normalization of symptoms and the general lack of awareness from health providers. These factors could delay a patient's diagnosis. Emma Cox, CEO of Endometriosis UK, informed the ITV that the inquiry should be the final warning to medical bodies and the government. Individuals can be offered mental health assistance and medication to manage symptoms. Treatment can include surgery and hormone therapy, but endometriosis has no cure.